You know, there's a lot about sex that people think is universally true, but isn't. And I'm going to tell you about some. Part 3. It is unsafe to use Plan B more than once. Not true. What's actually true is that using Plan B multiple times is not dangerous, though it can be expensive. Plan B is just one of many brands of emergency contraception called levonorgestrel. And it works just like hormonal birth control does. It stops ovulation, but only if the pill is swallowed within 3 to 5 days of exposure to sperm, and if the person hasn't ovulated yet. If the person is already pregnant, Plan B is not going to work, and it's not going to harm that pregnancy. If anyone tries to tell you otherwise, they're trying to scare you into not taking it. Plan B can be taken as many times as you need it. It will not impact your fertility. For people who weigh more than 165 pounds, it's actually recommended to take a double dose in order to increase effectiveness. Though honestly, it is more recommended to just use a different emergency contraception. This is an example of fat phobia and the fat tax showing up in reproductive health. The main reason it's not recommended to use Plan B as primary birth control is mostly because of expense. A single dose can cost $40, $50, $60, though generic brands, they can be cheaper. And the fact that honestly, it's just not as effective as birth control. When used perfectly, humans aren't very good at being perfect though. Plan B's maximum efficacy is 89% compared to the pill, for example, which, if used perfectly, is effective around 99%. And even when it's not used perfectly, the pill is effective at preventing pregnancy at around 93%. And I also should mention, methods like the IUD and the implant are 99% effective, and they last for years. That said, though, for lots of people, Plan B ends up being the most available and the most affordable in the moment to prevent a pregnancy they don't want. So that's what they're going to use, and that is nobody's business but theirs.